Welcome students, to today's lecture on medical nanotechnology. In this session, we will delve into the fascinating world of nanoscale drug delivery systems and their applications in various neurological disorders and brain-related treatments. Transdermal drug delivery offers many advantages, including improved patient compliance and sustained release of therapeutics. Biodegradable nanoparticles have gained significant attention in this field due to their ability to encapsulate and protect drugs while facilitating their delivery across the skin barrier. Fabrication techniques such as emulsion and templating methods enable precise control over nanoparticle size, shape, and drug loading capacity. The characterization of these nanoparticles involves techniques like electron microscopy, dynamic light scattering, and zeta potential analysis to assess their physicochemical properties and stability. Brain tumors present a significant challenge in terms of drug delivery due to the blood-brain barrier, BBB, restricting the entry of therapeutic agents. Multifunctional nanocarriers have emerged as promising platforms to overcome this barrier. They can be engineered with surface modifications to target specific receptors on tumor cells, enhance cellular uptake, and deliver therapeutic payloads directly to the tumor site. Additionally, the incorporation of imaging agents allows for real-time monitoring of treatment efficacy. Magnetic hyperthermia is a promising approach for brain cancer treatment where magnetic nanoparticles are employed to generate localized heat under the influence of an alternating magnetic field. This localized heating can induce tumor cell death while sparing healthy tissues. The size, shape, and magnetic properties of nanoparticles play crucial roles in determining their heat-generating capabilities. Furthermore, the loading and release of chemotherapeutic agents on these nanoparticles enable targeted and localized therapy. Neural implants have revolutionized the field of neurology by providing direct interfaces with the nervous system. However, implant-related complications, including infection and inflammation, can hinder long-term functionality. Nanomaterial-based coatings with controlled drug release capabilities offer a promising solution. These coatings can be engineered to release neuroprotective agents to prevent inflammation and promote tissue regeneration around the implant site, thus enhancing long-term biocompatibility and implant performance. Nanogels, cross-linked nanoscale hydrogels, have gained considerable attention as carriers for neuroprotective agents. Their unique properties, such as high water content, biocompatibility, and tunable release profiles, make them ideal for intracellular delivery. Nanogels can efficiently encapsulate and protect neuroprotective agents, enabling targeted delivery and sustained release within cells. Various stimuli-responsive nanogels have been developed to release therapeutic agents in response to specific triggers, such as pH, temperature, or enzymes. Before implementing nanoscale drug delivery systems in clinical practice, it is crucial to evaluate their potential toxicity on neural cells. Nanotoxicity assessment involves studying the interactions between nanoparticles and neural cells, investigating cellular uptake, oxidative stress, inflammatory responses, and mitochondrial functionality. Techniques including cell viability assays, fluorescence microscopy, and gene expression profiling shed light on the safety profile of nanomaterials and aid in the development of safer nanotherapeutics. The development of lipid-based nanoemulsions has opened new avenues for improving the brain penetration of therapeutics. These nanoemulsions can solubilize hydrophobic drugs, enhance their bioavailability, and overcome the BBB. Nanoemulsions can be tailored with specific lipids to enhance drug solubility, stability, and brain targeting. Additionally, surface functionalization strategies allow for active targeting of specific brain regions or cell types, facilitating precise drug delivery. Small interfering RNA, siRNA, holds tremendous potential for treating neurological disorders by selectively silencing disease-associated genes. Nanocarriers can protect siRNA from degradation and facilitate its uptake by neurons, ensuring efficient gene silencing. Surface modifications can enable targeted delivery to specific brain regions or cell types, minimizing off-target effects. Moreover, the design of stimuli-responsive nanocarriers allows for controlled release, prolonging the therapeutic effect of siRNA. Parkinson's disease is a neurodegenerative disorder characterized by the loss of dopamine-producing neurons. Nanoscale drug delivery systems offer a promising approach to enhance the efficacy of dopamine replacement therapies and minimize adverse effects. Nanoparticles can encapsulate and deliver dopamine or dopamine agonists, enabling sustained release and improved therapeutic outcomes. Surface modifications with dopamine receptor targeting ligands enhance the specificity of drug delivery to affected brain regions. Brain-on-a-chip models, incorporating nanotechnology and microfluidics, have revolutionized drug discovery by providing physiologically relevant platforms for studying drug distribution and efficacy. These models mimic the complex cellular architecture and dynamic microenvironment of the brain, enabling the investigation of nanoscale drug transport across the BBB and distribution within the nervous system. Such models aid in the development of more effective nanotherapeutics for brain-related disorders. Nanoformulations hold immense potential in Alzheimer's disease treatment by enhancing drug stability, brain penetration, and targeting. Nanoparticles loaded with anti-amyloid or anti-tau agents can efficiently cross the BBB and deliver therapeutics to activated glial cells or neurons. Surface modifications aid in target-specific delivery and enable early detection of disease-associated biomarkers. Effective nanoformulations can halt or slow down the progression of Alzheimer's disease, improving patients' quality of life. Real-time monitoring of drug release within the brain is crucial for developing optimal treatment regimens. Nanosensors, integrated with nanotherapeutics, offer a unique solution for monitoring drug kinetics, spatial distribution, and therapeutic efficacy. Nanosensors can detect changes in drug concentration, pH, or temperature, providing valuable feedback on drug release and biodistribution. The data obtained from nanosensors aid in refining drug delivery strategies, ensuring maximum therapeutic benefits. In conclusion, medical nanotechnology has opened up exciting possibilities for revolutionizing drug delivery in neurological disorders and brain-related therapies. The fabrication and characterization of biodegradable nanoparticles, development of multifunctional carriers, and utilization of nanoscale drug delivery systems demonstrate immense potential in enhancing treatment outcomes while minimizing adverse effects. As our understanding of nanotechnology advances further, we can expect to witness groundbreaking progress in neurology and personalized medicine.